Feeling and emotion. The reflections that follow on feeling and emotion are complicated. I suggest you let go of the effort you might make to remember what I say. Anything meaningful will be retained effortlessly. Now, let's begin. Imagine you're backstage behind a curtain, just about to step onto the stage to deliver an important speech to a large, eager audience. What sensations might you notice in your body right then? Let's take a few moments to picture it. Point as precisely as possible to the area where you feel the anticipatory sensations. Besides location, do these sensations that you imagine have any specific qualities, like tightness, shape, or color? Do the imagined sensations have an energetic aspect, such as movement or vibration? It's okay if the sensations you notice in the body are broader and fuzzier. Anger, joy, sadness, and guilt are labels your mind assigns to specific sensations it recognizes as distinct. Emotion, on the other hand, refers to the sensory component of our experience when we are having a feeling. Feelings are mental constructs, while emotions are sensory responses that occur in the body. Generally, the sensory aspects of complex feelings like anger, sadness, and guilt are experienced as pain. Even pleasant feelings, such as joy, can have a painful element. He was so happy it hurt. Many people who are asked to identify bodily sensations they imagine experiencing before giving a speech say something like, "I would be anxious." This is a feeling, not a sensation. Our minds tend to quickly recognize patterns of sensations by comparing them to past similar situations and almost instantly labeling the feeling, skipping over the awareness of the sensations happening in the body. For many of us, opportunities exist to deepen our awareness of our bodily sensations, that is, emotions that are the sensory companions of feelings. Most of the time, we use the words feeling and emotion interchangeably. However, when learning to respond to grief mindfully, it is helpful to understand that these words relate to different parts of our experience. Becoming more aware of emotions and how they manifest as sensations in the body is a skill that supports healing. Alan Watts, a philosophical entertainer, professor, and author of The Wisdom of Insecurity, gained popularity in the 1950s and 1960s. He reminded his audience that a restaurant menu lists the available food, but we do not eat the menu. In this analogy, the menu represents feelings, and the food symbolizes emotion and sensation. The Buddhist saying, "Don't mistake the finger pointing at the moon for the moon," captures the same idea. The human mind creates representations of experience. One might say it creates a virtual reality that should not be mistaken for direct experience. Do not mistake the menu for the food. Suffering often occurs when we confuse feelings and emotions. One way suffering happens when we mix them up is because we try to find relief from pain through thinking, even though it's the emotion in the body that needs our attention. In simple terms, we focus on the head instead of the heart. In popular culture, The common idioms and descriptive metaphors that follow highlight some characteristics of the sense experience that is often linked to specific feelings. He's so angry he might blow his stack. She was nervous. She had butterflies in her stomach. He was so scared his knees were knocking. They were so embarrassed their cheeks burned hot. He was very sad. It felt like a stone weighing on his chest. She was furious. Her blood was boiling. He was so frightened it felt like his heart was racing out of control. They were very relieved. It was as if a great weight had been lifted from their shoulders. She was overjoyed. She felt like she was walking on air. She was so frustrated that she wanted to tear her hair out. His head was spinning. He was so confused. She was very lonely. She felt small and invisible. Feelings and emotions are closely connected. It's not that one causes the other. Instead, they depend on each other, much like the body and the mind are interconnected and work together. Labeling feelings accurately can help reduce the pain of difficult emotions experienced during grief. I had a client who said, "I have two feelings, good and bad." Over time in counseling, she expanded her vocabulary of feelings. She learned the main feeling labels: happy, sad, angry, anxious, and lonely. She gained additional vocabulary within each of the basic feeling categories, which helped her name nuanced feelings and discriminate between feelings of differing intensities. For example, she learned that happiness has different levels, such as peaceful and smiling for low-intensity happiness or contentment, cheerful, optimistic, and tickled for moderate happiness, and ecstatic, jubilant, and overjoyed for intense happiness. As a result of greater awareness of her internal emotional process and better language to describe it, she suffered less. With time, she became more emotionally intelligent. In the Harry Potter stories, Harry, Ron, and Hermione, along with other students and professors, hesitated to say the villain's name. Instead, they called him "He Who Must Not Be Named." Later, they realized that saying his real name, Lord Voldemort, weakened his power, and avoiding naming him gave him a stronger hold over them. Our feelings are similar. We benefit from calling them by their true names. In mindful grieving, it is beneficial to expand our feeling vocabulary. Recognizing our feelings and becoming more skilled at naming them with precision can lead to relief. In mindful grieving, we also learn to bring awareness to the emotional energy we carry in our bodies, which manifests as physical sensations. Being aware of painful emotions allows us to send loving attention to the pain, which is a form of healing. Thich Nhat Hanh, a Vietnamese Zen master, once said that if we hit our thumb with a hammer, the other hand comes to hold the thumb, and it feels much better. Caring for painful emotions is the same. When we hold painful emotions in loving awareness, we feel better. May you be happy and well.